So you ready?
Yeah.
Tell me when.
Get ready.
Okay. And go. Okay. All right, so I can go now?
Yeah.
So that's the heart right there. All right, it's got this little sac to protect it around it. Okay. That's the liver. 1, 2, 3 lobes of the liver. Okay. If you look off to the side, I'm going to twist them on his side a little bit so we can see, because right behind it there, that reddish structure there, that's the lung. Okay, and there's another one on the other side. A bit difficult to see. He's hiding on this one, but it's difficult to see. There's the lung there. There's the fatty tissue, little pieces of the fatty tissue that used to be there, that white stuff. Okay. If we lift up the liver now, we can see the stomach here, going around the corner like that. And then where it gets skinny here, that's the beginning of the small intestine. Okay, it goes all the way along and it snakes along. Look, if you open this up like this, you can actually see the blood vessels going to the small intestine.
Yeah.
Too. See that thin, looks like saran wrap, or okay, and it's got all the blood vessels in it. Then it travels all the way down to the end, and it's difficult to see in this one because we still have that connective tissue. But right at the end here, the small intestine goes into the large intestine, and then this is the rectum, and then the anus will be over here. Remember these red structures here? Remember what they were?
Yeah.
Those are the kidneys, right? Kidneys over here, and on the other side you can see the kidneys. And then you see the reproductive ducts here. Okay, and we're guessing it's a female, although we didn't see eggs. Okay, because it's difficult to tell between the male and the female if you don't see eggs. That there, that red guy right there, that's the spleen. Okay, it's where we store a lot of our blood. Okay, and that's about all that you need to see. Okay, but we haven't looked inside the mouth yet. We should look inside his mouth. We're going to have to do a little bit of crunching to do that. Give me a second. We open up his mouth. Remember how the tongue came out?
Yeah.
I do have some cleaning solution. I'll get my hands on that in a second. This guy's got a bit of a smaller mouth, but I'm just going to cut. I don't know if you want to pause it for a second. Good thing is my patient. This isn't my patient. Pretty bad shape right now. Okay, so they'll let me open it up a little bit more. See? Okay, so there's the tongue. Remember, this sort of flies out and catches the fly, right? And it stays attached to you. Remember how weird that was?
Yeah.
This right here, that's the respiratory surfaces. It's also the areas where they, where their eye sockets are. So if you look at their eyes, their eyeballs are sort of in this area here too. But these flat surfaces are what they use for gas exchange. There, so you can see right there, that's the nostril right there.
Yeah.
Right? And then going down here, it's difficult to see, but right down here.
So what's that little thing
the
beside the nostril? That little square.
These are there's a name for it, begins with a V. Foraminiferous, or they're teeth. They kind of retract and close when they catch some prey, but they don't really chew anything or anything.
Yeah.
Okay. And then they've got teeth right here as well. If you feel here, it's really bumpy. You can actually even hear it. Can you hear? Listen.
Yeah, I hear it.
You hear it sort of grinding?
Yeah.
That's the teeth there. Okay, and the last thing you're going to want to look at is its eyes. And those are its ears. It's a tympanic membrane, so it's just like a speaker. Doesn't it kind of look like a speaker?
Yeah.
It works like a speaker. Instead of speaker gives us sound out, this thing feels the sound waves. And it vibrates, and then it says, okay, I'm hearing something, whatever they're hearing. Okay, and there's the nostrils right there. Right there and right there. Okay, so that's a little tour of the frog there.
Yeah.
All right. Now, if I'm on YouTube, then hopefully I sound okay. All right?
Yeah, thank you.
Okay.